Hi guys, welcome back to the channel. It's Dr. Somji. You guessed it. This next video is going to be about these. These pimple patches that you see all over the internet, celebs such as Hailey Bieber using it. It went viral when she used it back in, I think, like 2021. It's been really popular ever since with patients. Now, I want to give you the Pimple Patches 101. Basically, when to use it, when does it work, when you should not use it, and how you should use them. So these pimple patches are basically made with a substance called hydrocolloid. Now, colloid dressings are basically designed post-surgery or any wound to keep it nice and moist. So if you've got any oozing from any wound, it absorbs it, makes it into a little gel-like consistency, and also improves wound healing. There's many studies that look at wound healing and the moisture levels within the area. If they're a lot higher, they tend to recover a lot quicker. We're going to go through a few of the ones that I've seen on the internet, and I've ordered some of them. The one that's on my face right now is one of the most popular one. It's the Starface one, and they're just made of pure hydrocolloid. There's nothing else in there. So when should you use one of these? Well, look, actually, if you've got things like blackheads and whiteheads, also known as open and closed comedones, this is not going to really do anything because it won't penetrate the skin. These can only be used once maybe you've accidentally picked a spot, or when a spot is actually on its way healing. So if you've got a cyst that was really kind of angry and it's on its way down, you can pop one of these things on because it just limits the amount of scarring that you get. If you've got a wound, a pustule that is kind of oozing with material that's not really very nice, some pus coming out, once you can dry that with a facial tissue wipe, and then you can place one of these on and it will work quite nicely. But that's the first rule. It doesn't work on things that are closed. So if you've got those if you've had a spot and you're still getting some redness in the area, these are good, and that's post-inflammatory erythema. So hydrocolloid, pretty good. I've got another one which is actually interesting. It's called the deep action ones, and actually this has got hydrocolloid patches in them, but it's also got salicylic acid. So when you've got a spot, this has got salicylic acid which basically dries out the area. It can improve how quickly it returns, reduces the bacteria level within the area as well, and may eventually reduce the redness a lot quicker. These are not completely proven, mainly because they don't penetrate the outer layers of the skin, but putting a little bit of topical or salicylic acid on is going to help clear that spot a lot easier. So what is the summaries? Well, the summary is that if you've got blackheads and whiteheads, forget about these patches. You maybe want to use some of the other ingredients that I talk about on my channel, namely azelaic acid is fantastic for clearing those things. If you've got a red kind of spot within the area, i.e. a pimple, then yes, you can put these patches on. They help resolve the wound healing a lot quicker, reduce the redness, and also possibly prevent scarring as well. If you want to know any more questions about pimple patches or any other trends that you see on any social media channels, just let me know in the comments below. If you've got any extra questions about how to use these patches, then just let me know too. Also, don't forget to subscribe because you get sign up to all the latest videos, and we're always coming out with new content.